Good morning. Happy Monday.
Morning.
It is just 11:30. We'll get started about 3 after. If you wouldn't mind, as we join, could you enter your name and your organization's name in the chat? Robert, I saw your message this morning. Congratulations.
Trying to add more and more to the profiles so it is effective, and I have effective tools to do this work.
I love it.
How is everyone, and happy holidays?
Happy holidays. I don't know where the year went, but we've officially been a full year in our Path Collaborative. I can't believe it. So we'll do a little bit of fun activities today. And then as a general reminder, we have the office hours, managed care plan office hours following today's event. And let's see, we got another minute or so, we'll get started. If you're just joining us, please enter your name and your organization's name in the chat. And then Emily, if you don't mind, can you move us one more slide to the agenda for today? And we'll go ahead and get started. We're a smaller group than usual, but we sort of kind of figured as much given the holiday season. We do have a full agenda today, but we'll have some fun with our icebreaker activity. And then our general activity will be sort of a 2023 reflection and thinking through some ideas for 2024. We also have a few community announcements, and Christy Rosenberg, who's going to do a presentation on the neighborhood network, try to increase overall awareness and some of the things that are available in San Diego. All right, Emily, if you don't mind going to the next slide for me, please. And for those on the line, we're hearing a little bit of background noise. If you don't mind muting, unless you're sharing something, that would be great. But now it's time for sharing. So we want to know, yeah, looks good, Emily. What is one gift you'll never forget receiving? Now, it doesn't necessarily have to be a holiday gift. It can be a birthday, it can be a Groundhog's Day, it can be any type of gift you've ever received. But in the chat, or raise your hand or come off of mute, one gift you've never forgot. I'll share with you mine. My younger brother was born on Christmas Day. And so one gift I'll never forget receiving is the year that he was born. He was my first brother, so it was my first time having a sibling. And I was super duper excited to be a big sister at age 12. So for me, that was one gift that I will never forget receiving. Anybody else? I'll pick on my intrepid peeps. Oh, Claudia, that's a sad one.
But so sweet and special.
Our dogs are our babies.
Definitely.
Grandmother's ring. My grandmother has a snowflake necklace, and every December 1st, she puts on that snowflake necklace, and I swear either on that day or the day after, we get snow. And so we force her to take it off come March because we're in upstate New York. And by March, we're sick of this weather and ready for the sun to shine again. Anybody else? I know it's a toughie. Julie, how about you? What's one gift that you will never forget?
This is mundane, but at a holiday party a couple of years ago where we, were exchanging gifts, the white elephant type stuff that you bring, okay? And I actually got a set of porcelain bowls that we use for pasta and a dozen other things that I've never been able to find anywhere other than that source. And we just love them. So we probably use them 3 times a week. So it's the perfect example of one person's trash is another person's treasure.
I love it. I love it. Thanks for sharing.
And speaking of trash, what you heard in the background was our trash pickup today. So I hope it wasn't too loud.
Oh, the Hess truck. Boy, do I remember those.
Oh my God, I love him so much. I don't know why a little girl would just go crazy over truck toys, but here I am.
Oh, Stacy, that's a good one. Jeremy, a mountain ride. Wow. I love all these dog stories. We're gonna have to do an animal icebreaker for stereo in the late 80s. Hey, no judgment there, Mallory. I still had I'm sure I'm dating myself, but I was so excited to get a pager. It's like the thing to have. Any other shares? I think we gave ourselves a little bit of time today to kind of just pause and think about some things that are meaningful to us. Emily, how about you? You're the one that put this presentation together.
Right now, I have a very sick baby on my lap. But also, Robert, you had your hand up. Did you share?
Look at him. Oh,
Yeah, he just got back from the pediatric or urgent care. We have some asthma.
So yeah, I actually did raise my hand. What was the one real gift I'll never forget receiving? So during my adolescent and young adult years, I was constantly misbehaving, having issues, and I had a friend who I just buried, died of cancer, and it really didn't occur to me how valuable a friend he was until he was gone. The tough times and the good times, but he was always there.
Oh, Robert,
So
what a wonderful
real
story.
friendship.
Friendship is the best, isn't it? I say friendship is better than family any day. I'm glad they're not in the next room listening to me, but family is good, bad, or otherwise, but you get to choose your friends, and it sometimes is the most meaningful and lifetime commitment that you have in a friendship. So what a wonderful story, Robert. Thank you so much for sharing. I don't see any hands. Emily, let me know if you see somebody with their hand up, but we'll keep moving along if we've got no more shares. I see you handing off the kiddo because Emily is probably going to want to talk to everybody about the next thing that's on the agenda. I won't put you on the spot, Emily. If you've got some stuff going on in the background, I can do it as well.
Nope. I can take a moment. He's going to go lay on the couch with Daddy. So, so for 2024, we have a new meeting series. So we tested out the registration aspect of Zoom for the last half of 2023, and nobody has said that they've gotten millions of invites or emails. So we're gonna stick with it for 2024. If by any chance anybody has existing calendar invites for 2024 on your calendars, whatever calendar you use, those are not good. Delete them. And before you register and add them to your calendars again, okay? And also thank you for everybody for the well wishes for Owen. He's a ham, but you know, when he's down and out for the count, when he's sad. And so thank you guys for that. And anyways, back to the meeting invites. So we have a new meeting series for 2024. The Zoom links I'll share in the chat once I'm done with my spiel. And then we also have a new series. We are retiring our coffee chats, and we are moving to office hours. And nope, Nancy, I see your comment in the chat. I haven't sent any 2024 registration links out. We waited until the very end of 2023. So now everybody can register and start brand clean. So we have office hours, which will be, I believe it's like the first Thursday of the month. And then our monthly meetings are on the same day, same time of the month. It's just a new registration link, which will give you new Zoom information to join with us today. And then I just want to take a moment to really call out, when you guys click on the registration link, this is what it's going to look like. You're going to see the San Diego Pass CPI Collaborative Monthly Meeting at the very top of your screen. You're going to be able to select the dates that you want to attend. You can select all of them if you want to be with us all year round, which I hope you will. Or if you know you're going to be out for like May 17th, then you'll be able to just skip that one. Fill in your information and hit register. And then you're going to receive an email that's going to look something like this. And then at the very bottom, towards the bottom of that email, you're going to see something that says add to calendar, whether it be Calendar, Google Calendar, Yahoo Calendar, Outlook. Just click those links, whichever calendar you use, and you'll be able to import all of those events that you just signed up for into the calendar of your choosing. Okay. And you guys might have seen that, for example, we go from March to May. That's because April and October of next year, stay tuned for the monthly meetings and the registration for those 2 months for next year. And then I think that's it. Does anyone have any questions, comments, concerns?
If you do run into any issues with registration, please, please, please let Emily and I know. We are hoping to put a period at the end of any registration issues that we had in 2023. So excited to move forward with this. We don't think at this time that the standing meetings will change. But the reason that you haven't received one for April and October is that those will most likely be in person, which means they'll take a little bit more coordinating on our end. We're also trying to do a couple of things with them, and we'll talk about those later. One of which is try to align with other things that are happening in San Diego, maybe save you all some travel. If not, we'll try and be as accommodating as we can to everybody's busy schedule. Ideally, we'd like to do 3 in-persons in 2024, but right now we're committing to February and October. If we were to add another in-person, it would most likely be sometime in the summer, just so that they're spaced out, but also recognizing that the summers are a little tricky for folks based on calendars and school coordinating. So, and vacation, school and vacation coordination. So, so that's what we have going on. Can nobody hear me? Have I been muted this whole time?
No, you've not been muted, Denise.
I don't know what I'm doing half the time. It's the buttons. Okay, so go ahead to the next slide for me, and this slide is gonna stay. You'll probably see this slide again in each of our decks for 2024. Though you may see some changes. So for those who are not frequent visitors of DHCS's website, I'm going to say it again. I may sound like a broken record, but the reality is that I can barely remember last week. So it's a helpful reminder when you're navigating DHCS's website, some things have changed. And so locating some information on DHCS's website is in different places than it was before. And you'll see some different naming conventions than you did before. So historically, everything that we talk about is really under that CalAIM umbrella. The work that we do to help improve those on Medi-Cal, the services that we talk about, best practices and opportunities for improvement around enhanced care management and community supports. Those all fall under that CalAIM umbrella. And now DHCS is using a Medi-Cal transformation. So in other states across the country, it's called Medicaid transformation. Oftentimes it's referred to that in connection to something called an 1115 waiver. All of that is somewhat irrelevant to the work that we do day in and day out. But when you're trying to navigate something, you may not see something glaring back at you under CalAIM, but rather a Medicaid or Medi-Cal transformation naming convention. So if you're doing a Google search, that's where you'll see it. Go ahead for me to the next slide. All right, we're going to do some community announcements. Christy, before I hand things over to you, I think I've got two quick announcements. One I'll go over, but I think we've got 211 on the line. Joanna's also on the line. So if there's any questions, please enter them in the chat. So just because we're at the end of the year, I just want to remind folks that there is a CalAIM resource directory. So each of the managed care plans have a list on their websites of their contracted CalAIM providers, that's enhanced care management and community supports providers. In addition to each of the managed care plans, the CIE San Diego 211 has a resource directory. It's a full list by provider, which includes the managed care, the services that they offer, enhanced care management, or one of the 14 community support services, which managed care plan they are contracted with, and hopefully some additional information. We've continued to survey you. We'll probably continue to bug you in 2024, as probably everybody else is. To get some additional granularity. Why do we do that? Because it's a central repository or a place where you can go to see all of the enhanced care management and community support providers in the community, not sort of contingent on whichever managed care plan they're contracted with. So if you haven't gone out there, Emily, I think if you don't mind putting in the chat for me, maybe you already have, the resource directory link. Check out your information. If it's missing, if there's outdated information there that needs to be updated, there's a form that you can complete. We're getting ready to move into a new year, so let's use the opportunity for some general housekeeping and get that information up to date for the new year. And then in addition to that, and to those links, Reminder as well, let us know how we're doing. DHCS wants to know, PCG, our sort of governing body, our administrator for these paths, CPIs. They want to know how we're doing. It's an opportunity for you to share some feedback with them and with us in an anonymous way. So please take the time. Yes, I know it's survey fatigue. But your voice is important, and this is oftentimes the most common way of collecting that. So if you do have the time in the next few weeks, please complete that participant survey. And then Nancy, if you've got a quick second to come off of mute, maybe you could talk a little bit more about that recuperative care survey that we pushed out in Slack last month.
Yeah.
Thanks.
Hi, everyone. So PATH, Interfaith, Father Joe's, and 2-on-1 have been working together to try to increase recuperative care utilization. So we've completed focus groups with some of the big hospitals in the area and a few of the health plans to get their perspective on what are some of the barriers and things that are working well. And the part that's missing from the conversation is the referrers, the ECM providers and CS providers. So we welcome your input. It's a pretty quick survey, I think. If it's not, you can blame me because I put it together. But it's just a quick way for us to see what are those challenges in terms of referring folks in. And, did you know that you could refer from the community? They don't have to be from a hospital, for example, and kind of what your experience has been there so we can make improvements. That's it.
Thanks, Nancy. And this is a link as well in our presentation deck today. We'll share all of that with you guys via Slack channel as well. And without further ado, I thank so much, Emily, for that. I'm going to hand things over to Christy. Maybe Christy, I'm sure folks know who you are, but maybe you could do a quick intro about the San Diego Wellness Collaborative before getting into the neighborhood network. And I think we've given you access to share your screen.
Great. Thanks, Denise, and thanks for the opportunity to share a little bit more about neighborhood networks. And I'm going to be tag teaming this presentation with Mackenzie Fisher, who's also joined us today. So Mackenzie is Director of Neighborhood Networks. So we'll be going back and forth on a couple slides a little bit. But I think some of you, just a quick introduction. So Christy Rosenberg, I'm COO for the San Diego Wellness Collaborative. And I think some of you may be familiar with a couple of our different initiatives, Be There San Diego and the Accountable Community for Health. And then most recently, we have added Neighborhood Networks, which is our initiative that houses all of our CalAIM and Medi-Cal transformation services. So we're going to be spending most of our time today talking about neighborhood networks. I'm happy to share more about the Wellness Collaborative if people have questions or if we need to, but we're going to hone in on neighborhood networks. And I know we've got time, Denise, I think on the agenda, we've got time for a brief presentation and then some time for discussion. So if people have questions, please feel free to either put your questions in the chat or people can come off mute, and we're happy to take questions along the way. So I think Mackenzie is going to run our slides for us. So just a little bit about our neighborhood networks model. So what we have put together is a kind of a one-stop shop for community-based organizations. So Neighborhood Networks serves as the intermediary between the managed care plan and the community-based organizations. So we hold the contract with the managed care plans, and then we partner with a network of community-based organizations that actually hire the community-based workforce and provide the direct services. And really, one of our goals for creating neighborhood networks was to come up with a cost-effective way and a coordinated way to support community-based organizations as they think about providing these CalAIM reimbursable services. So Mackenzie, I think you can go to the next slide. So Neighborhood Networks was formed in 2019. We were part of the original Health Homes pilot and then transitioned to enhanced care management and community supports. And again, really supporting non-clinical community-based organizations that serve the Medi-Cal population. So really looking at those trusted community-based organizations that are in the community, who have employees that are from the community, and really looking at that as a trusted network to serve community members. So that's really been kind of our approach with neighborhood networks. And so a little bit about kind of the partner roles as we kind of divide up responsibilities with this type of model. So as I shared before, the managed care plans contract with neighborhood networks, and then neighborhood networks contracts with a network of community-based organizations. And neighborhood networks also provides kind of some hub infrastructure, so, case management system, claims and billing, and reporting. So we handle all of that kind of data management back to the managed care plan. And I think Mackenzie's gonna get into a little bit more of the details around that. And then each of the community-based organizations hire and supervise the community-based workforce. And that's the workforce that is providing the direct services in the community.
Thanks, Christy. I'm not sure if it's your connection or mine, but you're freezing just a little bit for me. So let me know if I'm glitchy. Just pop in the chat maybe. Hi, everyone. Okay, so right now we are currently, this is our current list of CalAIM. Let me just move everyone's faces, sorry. All right, this is our current list of CalAIM programs. So we have a network of CBOs right now, as Christy mentioned, providing enhanced care management services to all populations of focus. And of course, planning to expand those populations of focus, hopefully in 2024. As those come out. We are also currently providing community supports for Housing Trio. So housing navigation, supports, and deposits. And I'm proud to share that we have successfully housed several members under deposits, just a really life-changing benefit. So we've been able to see the power of that under community supports. We also have community health worker services. We have a workforce that is medically integrated, so they are positioned at clinics supporting care teams, and we also have a community-based workforce under our CHW services. And then I'm sorry, I skipped over asthma remediation and medically tailored meals under community supports. We do currently have the contracts for those, and we have partners of ours that are interested, but that has not been initiated quite yet under our services. And then Save for Doula services, we're currently exploring that right now and hopefully rolling that out in the near future, but that is pending. So this is a list of our current partners. So the first column, you'll see all of our CHW service partners. And second, you'll see our 3 enhanced care management teams and our 2 community supports housing teams. Several of our teams are planning to expand in the beginning of 2024 to other services across this matrix. So we will continue to share updated tables as our teams expand, but this is a current snapshot of our services and our network partners. We have a custom case management system that we've been working on since way back since Health Homes times. And it is a custom service for neighborhood network services. So all of our services, CHW, Enhanced Care Management, and community supports utilize this case management system. And it is designed to meet all of our contracts across the managed care plans. So all of those requirements are built into the case management system. So the workforce all just document in one system for now, mostly for now. And so that really supports our team with quality assurance and reporting needs that we have back to the managed care plans, and it supports our workforce in documenting everything in one system and seeing it as a snapshot. We do have a tool called Care Maps being built right now that I'm really excited about. This tool is going to support our enhanced care management workforce in the process of completing those very long, comprehensive assessments that gather all of that really, really important information for serving the member and help them navigate what needs to go into the care plan, what type of actions and other support they may need, all clearly laid out for them in the system. So that is coming in early 2024 for our case management system. And we're also working on building connections to the local referral platforms, and have initiated that within our case management system right now. In addition to all of the documentation required for those different services, we also house all of our claims management within our case management system as well. Not house it, but it is pulled from our case management system and connects with all of the other platforms needed to generate electronic claims. So we have a team focused on the full claim cycle coming from our case management system into the other platforms and formats required by our contracts. We've also developed a learning management system. Our Chief Learning and Development Officer has been working hard over the last couple quarters to develop this for the workforce. It includes a resource library for each service, program templates and guides for our CBO partners. So that includes a program guide, and then she is finalizing all of the role-specific guides for our services. We also host monthly workshops on relevant topics. So that may come from quality reviews that we do that highlight areas for training needs or requested and consistent training topics. So we have that monthly time with our with the workforce to provide that support. There's also on-demand training for our case management system. So every time we get a new network partner and they hire and train a new staff member, they are able to use this on-demand system now within our learning management system to train for our case management system. And it also includes a 101 training on ECM and CS housing for those navigators under that service. I'm going to hand it back to Christy to finish up these slides for us.
So hopefully my internet will be a little bit more stable and we can get through these next couple of slides. So just to kind of reiterate our hope with the neighborhood networks model is that for managed care plans, they're able to offer one contract that supports a network of community-based organizations that is really focused on meeting their highest risk need members and providing coordinated care across multiple populations. And so for community residents, our hope is really that with this trusted workforce, with this network of community-based organizations that has the community-based workforce, that they're really making those one-on-one connections with community members, connecting them to care, helping them coordinate their care, and following up, as Mackenzie said, on assessments, care plans, and the other requirements of the Medi-Cal services. And then for our community-based partners, we're really hoping that this model supports them with a sustainable revenue source for their community-based workforce. So really helping them tap into those dollars that are available through Medi-Cal. And as Mackenzie highlighted, we have our secure case management system. We follow up on compliance with all of the managed care plans and Medi-Cal regulations, and work with the community-based organizations on all of those requirements, in addition to the billing and claims management component. We didn't get too much into this, but Neighborhood Networks also provides outreach and enrollment support. So really helping to identify those members through community referrals in the community that may be eligible for these services. So we work with a network of partners, helping them do in-reach with their current populations that might be eligible for services, as well as outreach. And then Mackenzie mentioned our learning management system and some of the other resources that are available for the community-based organizations to access. So with that, Mackenzie, I think that's our last slide, other than contact information. So we're happy to answer any questions anyone has, or go in depth in any more of these areas. I did get a couple messages in the chat specifically about medically tailored meals. And as Mackenzie said, we haven't rolled out that service yet. We have it included in several of our managed care contracts, but we have not established that network or began providing those medically tailored meal services yet. So it's something that we're considering for the future, but we haven't rolled out that service yet. So with that, Denise, I'm happy to take questions. It looks like I see Robert's hand, and there may be others.
There was a question, Robert, before I hand it over to you through Slack. Stacy, you had asked for something specifically during Mackenzie's presentation. Can you elaborate on what you're looking to find, and we can get that connection to you?
It was for the monthly meetings and the on-demand training.
So Mackenzie, I don't know if you want to follow up directly with Stacy, or if you want to share that in the Slack, that would be great. Or excuse me, the Slack, the chat. Now, it could be also to Mackenzie, and I don't want to make any assumptions. Are those things available to your in-network and contracted participants?
Sorry,
Yeah,
I'm having some mute issues over here. Gosh, can you hear me okay?
Yeah.
Okay, sorry about that. Yes, this is for our in-network partners. So all of our enhanced care management and community supports navigators get together every month, and we discuss certain topics that are identified through quality or requested by the workforce. It could span all different topics: condition specific, process, program, resources, but that is for our in-network partners, yes.
Thank you for that. Robert, how about you? It looks like you have a question.
Yeah, thank you. Actually, I think it was when Mackenzie was doing her presentation, I believe, when you guys were talking about the future, and not medically tailored meal, but the doula. So is this a birth doula or a death doula, or both?
So this would be a birth doula. So that's the Medi-Cal service that is coming soon.
Okay.
Good question there, Robert.
Any other questions for Christy and Mackenzie? And again, this will be recorded and shared on our website, as is all of our monthly meetings, and the deck. I know Emily shared the PDF in the Slack channel. Christy, we can work with you and Mackenzie if you want to share a PDF in support of today's meeting, then we can share that with the group as well.
Sure, happy to do that.
Any other questions for Christy or Mackenzie before we move on to policy updates? Well, thank you so much, both of you, for your time. I really appreciate it. I think one thing that we want to continue to do in 2024 is elevate what services and supports exist in the community. And so one thing that we've talked about, especially with some smaller community-based organizations, is how do I work with others that are doing same or similar services? How do I address things like billing that I've never needed to address before? And where do I sit from a workforce and then also from a bandwidth perspective? So, looking at the neighborhood network and looking at other resources that are available in San Diego are really helpful to know what things might be available to you as you're considering contracting and what that might look like for you as a community-based organization. In 2024, we'll continue on, hopefully, with this spotlight format in our monthly meetings. So we'll invite you, each of you who are participating in the PATH Collaborative today, to talk a little bit more about best practices, and we'll be looking at ways that we can introduce new guest speakers, not necessarily those that are just from San Diego. One thing that we've heard through 2023 is, gee, I wonder, what some other communities are doing in regard to best practices. So that's something else that we'll try from a content perspective to bring to this group in 2024. And Emily, I'll let you go on to the next slide for me. But before I start talking about policy updates, I'll just plug that DHCS is also trying to elevate best practices across the state. There have been 2 webinars thus far. The first webinar was at the end of October. And we were given the opportunity to talk a little bit about Calium Academy. So kudos to San Diego folks. We were one of the first to share some best practices around Calium Academy and the work that we're doing in that with Calium Academy, different session types and ways that we can engage community partners who maybe aren't part of this work day in and day out. And then last month, there was a best practice webinar where there was some really cool information shared from, I want to say it was Sacramento, but around universal referral forms and process mapping for referrals. So they haven't yet, Julie, published those materials, but I've been on the lookout for them as well, and we'll push something through the Slack channel for folks when that recording and Q&A is available. And then these sessions themselves will occur in 2024 as well. I think the goal is once a quarter, but it may be twice a year. So they'll be a lot less frequent, but there'll be collection of best practices across the state. Okay, so state policy updates. I've highlighted a few things here in red, the first of which is cited round 3. So for those who are looking at cited opportunities for 2024, the application was actually published today, so we can share some links with you. I don't even know, Emily, if I've had a chance to give you the link, but we'll share them with materials from today's meeting. So it's being published today, cited round 3. And application window is going to be in January. So it feels like a lifetime away, January 15th, but it's right around the corner. So if you are interested in round 3 for cited, the application will be published today and the window will be January 15th to February 15th. For the data exchange framework, so this is sort of CalAIM, Medi-Cal transformation adjacent. It really has to do with building a framework and sort of rules of the road, if you will, for the state of California around data sharing. And so this is bigger than just CalAIM, bigger than just enhanced care management, community supports providers, and managed care plans, et cetera. It really talks about different sort of required signatories, required organizations to participate in the data exchange framework, and encouraged organizations to participate in the data exchange framework. And the timeline for that is different based on the fact, based on whether or not you're a required or an encouraged signatory. But in particular, I want to just elevate that they extended a deadline. So there was a deadline for some funding available to do that work. That deadline was the 15th of December. That's been extended to the 20th. So just a few more days away. But that has been extended. So if it's something that you were hoping to do, but didn't get a chance to do, but you have something in the works, you do have a little bit more time to get that application in. If you've got questions around the data exchange framework, please drop your email address in the chat, and we can make sure that we give you the links for the data exchange framework and the grant application processing. TA Marketplace, don't forget about the TA Marketplace. So all TA recipients can access off the shelf. So this is just something that you would get, and then the work that that you would do would sort of be a little bit more hands-off. And then hands-on projects working with whomever it is you choose to work with as a TA vendor to really think through different aspects of your work to either get ready to do additional things as an organization. What are those things? There's a whole host of different things on the TA Marketplace, and it ranges from human workflows, different things that you could do from a capacity standpoint, different things that you might be looking to implement from a technology standpoint, anything from community goal settings to help looking at a specific software that you might be implemented, so working through that procurement process. So if you're not familiar with the TA Marketplace, we could share some links with you on the TA Marketplace as well, and we'll talk with you all about it in the new year. These are things that are available to you, and the state is really covering the cost in large part for this work. So there, you know, especially when we talk about resource constraints, these things are available resources to you. Some conditions around the TA Marketplace: if you are not an enhanced care management or community support provider yet, you do need to be one in order to receive an award through that TA Marketplace, or you need to have some conditional paperwork and agreements with a managed care plan. So you either need to be a contracted provider already, or you need to be in process of contracting to be eligible for the TA Marketplace. And again, we can talk with you more about it offline. There are some helpful resources on the state's website as well for TA Marketplace. Last but not least is PATH Justice Involved funding. So there is funding that's available to you. They sort of had a soft close in association with that funding, but there are still some things that are available to you if that's something that you're interested in. We can share with you some direct contact information, or you can reach out to PCG directly to discuss what potential opportunities there are regards to JI funding. Emily, if you could, for me, move to the next slide. Another reminder about 2024. In addition to a whole host of other things happening in San Diego for 2024, just really wanting to elevate again that we have 2 new populations of focus. So birth equity, and we have put on here the eligibility criteria, but we can share with you all some links as well for DHCS. There's a policy guide that outlines these in much more granular detail. We can share that with you. There's other resources available to you in San Diego. There is a justice involved work group that meets regularly. Just kind of elevating again, these are 2 new populations of focus. And so for those folks looking at justice involved, remember there were 2 things that were sort of maybe happening in 2024. The one that we talked about quite a bit and got talked about across the state and quite frankly across the nation was the 90-day pre-release. That's not happening 1/1 of 2024, though it is still moving forward. The dates have been extended. But what is happening come January 2024 is that new population of focus. And Dr. Tudor, I see your hand up.
It is. Thank you so very much.
Absolutely.
I'm so excited. So many people are on this call today. For those I don't know, my name is Jen Tudor. I'm a family practice doc and have worked in community health centers here in San Diego. And now I'm honored to serve as the associate or assistant or something, chief medical officer here at the county. And just wanted to share with the group, and especially I'm so pleased that so many health plans are on. Obviously this whole team has been working on some best practices, namely like for enhanced care management, to have that presumptive eligibility. So as we're seeing people, especially like people experiencing homelessness or folks where we're with them right there on the front lines, and it would really be so much more efficient to be able to start enhanced care management and things like that, rather than sending in a request for authorization or a referral and then a request for authorization. And then by the time, that comes back, even if it's a day later, the person isn't in front of us anymore. We're really hoping that even if it's just in this population of focus, that by January 1st, we can go forward with that here in San Diego with our 4 plans, that presumptive eligibility for individuals transitioning from incarceration, because it really is that opportunity as people are being released from a correctional facility or being released from probation for our youth, that we know that obviously they're in our custody and are being released, and we would know for the adults if they do have one of those conditions. So I know that Sayon, Dr. Thihalo Lipavan, and I will be, meeting with the medical directors of the 4 plans. And it has been a discussion in Healthy San Diego and here in so many other places. But we're really hoping that even in just this smaller population of focus, if that needs to be like the first step to kind of test this out, that with the health plans, we can really start providing ECM services, the providers, not we, the county, but the providers on the ground, as we have that wonderful opportunity. So I just wanted to share that again here for folks who weren't aware. I know that, I've been a nonstop record on repeat, or maybe that's like an iPhone on repeat. I don't even know the up-to-date lingo on that yet, but it really will help everyone be much more efficient and help us meet our goal of this group, right? We have that SMART goal of by increasing enrollment in enhanced care management and community supports, which is everyone's goal. And so I just wanted to share that, being totally transparent and open for any questions, but thanks for the opportunity.
Absolutely. Thank you so much for sharing that, Dr. Tudor. I had a couple of really great conversations about that as well. And I think maybe we should just keep this as an elevated open item and not, I won't put the managed care plans on the spot today, but love to kind of talk with each of the managed care plans in more detail about that. Maybe you could give us an update after you meet with the medical directors. That would be really great. There's a lot of case studies on care transitions following incarceration on release, and some really cool things that might be available in San Diego that maybe not are not necessarily available across the state. I know that the CIE, I think, is working on critical alerts associated with release. So when we think about care transition, just in general, how do I know that I need to pick up the ball, kind of thing as a care provider? And so these types of notices are really helpful as long as they don't become noise, right? Because we know we're all crazy busy. But there's some evidence across the nation of these release alert notifications and the impact they have on care transition to a primary care physician and enhanced care management provider providing services to know when they need to re-engage with a person. So lots of really cool things and really, really excited for where San Diego sits in comparison to some other folks across the state. So let's keep that conversation going for sure. Emily, if you wouldn't mind going to the next slide for me, please. I think I have one more thing that I want to mention before we get into our activity today. So for those who aren't aware, we have 2 managed care plans leaving our network. So I just want to, I don't know if we've got Aetna and HealthNet on the line, but Aetna and HealthNet have been amazing partners over the years, and they continue to stay engaged even though they're leaving the network beginning 1/1 of 2024. They'll still be around. We still have some great contacts there, and we did a managed care plan transition webinar last month, but January 1, 2024, I don't know if things will be crazy, but a lot of work has been done in collaboration with the managed care plans to make this as smooth of a transition as possible. There's a whole policy guide on managed care plan transitions, and we can share some links. There's some things that have moved around on DHCS's website, but I have a couple of links to share. Emily, I put them in the deck, but if you can't access them, I can share them after the fact. There's a very helpful tool and web link for members, not to say that every member is going to have access to a computer and access to the link, but some of the member tools and resources are helpful to providers, because you can kind of see to some extent what members are seeing. There's, I think, some correspondence, FAQs, the letter that went out to managed care plans or to managed care plan members that are being transitioned. There's also a helpful tab on continuity of care. So this kind of outlines some critical aspects of the managed care plan transition and continuity of care. So how do we make sure that members are not displaced during this point of transition? And there's some rules that managed care plans are following as it relates to that. And then there's some other additional policy guides and FAQs around that managed care plan transition. So for those that are maybe less familiar, Blue Shield Promise, Community Health Group, Kaiser, and Molina will be sticking around for 2024 and beyond. If you do have any issues in the next couple of weeks, we have contacts at the managed care plan. We have a contact card. We have that available on our website, and I'll be around through the holidays. I'm not taking PTO actually this holiday. So if you're running into any issues, feel free to reach out to us directly on Slack or via email. And we'll do the best that we can to act as an intermediary. We also have amazing resources at the county who have continued to be helpful in that sort of escalation if needed between a managed care plan and a community support provider, another provider in the community. So those resources will continue to be available. So please feel free to let us know what's happening. And if you are running into any issues, we have some pretty receptive managed care plans as well. So we're here to support, but recognizing that not everything is perfect ever. And so when and if you run into an issue, please let us know and we'll help navigate. Remember, for the folks at Intrepid, don't send us any of your PHI. We don't want to know about a specific member or a SIN number or social security number or anything like that. You can let us know in general that you're having an issue, and we can work with the county and or the managed care plan to get you the support that you need. But don't tell us in your email or in the Slack any specifics about that member or about the issue at hand that are specific to PHI. Okay, if you wouldn't mind for me, Emily, go to the next slide. I think that brings us into our activity for today. And we also have a Jamboard. I'll preface, if everybody, if there are folks that can't access the Jamboard, we'll have you use chat really quick to tee up the exercise. What did we do in 2023? It never feels like it's enough, but I'm really happy that in 2023 we got to know all of you. I am continuously amazed at how collaborative San Diego is as a community. There is so much amazing work that's happening in San Diego that it often feels duplicative. And that is better than nothing at all. In across the state, you see some communities with a lot less infrastructure and support of one another. So just kind of wanting to elevate that again. We did some work in January in the first quarter, getting to know each other, brainstorming, getting an idea of what's happening well, what issues we have, and where do we want to focus. So building that SMART goal or that collaborative aim in the beginning of the new year, and some drivers to kind of help categorize and support that overarching goal. In the summer months, we started to build some, we call them PDSAs, Plan, Do, Study, Act, and started to execute those PDSAs behind the scenes. We can talk through, and we've shared in some past meetings how we're translating some of the work that we're doing into that, that framework. In addition to that, we had our first in-person in September, and we started to build out a best practice playbook. That's gone through its first draft and has been shared with a focus group, and will be, I think, hopefully shared over the course of the next couple of weeks with this collaborative. And we'll talk a little bit more about the best practice playbook in first quarter. And think through maybe how we can lean on that to do more good work in the community. Fast forward to December, which is where we are today. We're going to spend a little bit of time looking back on 2023 and forward to 2024. What do we want to stop doing? What do we want to continue to do? And what do we want to do that we haven't been doing in 2023? So that is going to sort of guide our exercise today. Emily, if you want to go forward to the next slide for me, please. I think we have a picture of our aim. So for those who don't remember, we came to an aim statement in the beginning part of 2023. We modified that in the summer months of 2023 through the data standardization work group, which was stood up in 2023. And we have some concrete enhanced care management community supports goals. We got our Q3 reports just recently from our managed care plans. So thank you, managed care plans. But we should know sometime early in 2024 in January whether or not we were able to meet these goals, either through the PATH CPI or through the other good work that's happening in and around the community outside the PATH CPI. So we'll have some information to share in January as it relates to these numbers. Emily, next slide for me, please. I think is where we hit our Jamboard. Start, stop, continue. Start. What do we want to do in 2024 that we're not doing today? Stop. What do we want to stop doing? What do we want to stop doing in 2024 that we're doing in 2023? And what do we want to continue to do? What do we think that we're doing well? What do we want to lean into more? And so for those of you, Emily just shared a link in the chat to a Jamboard. If you cannot access that Jamboard, please enter your feedback in the chat. But it should be pretty easy peasy. You can double click on any of those little post-its and enter your feedback. We've got roughly 30 minutes for this, so don't be shy. If you're having any issue at all with the Jamboard, please share your feedback via chat. But we really want to know from you all, recognizing we're a little bit smaller of a group this month because of the holidays. We'll share this out through our Slack channel. So we'll try and elicit feedback from other CPI participants. If you know your partners that you work with and you don't see them on today's meeting, please, please, please feel free to share this with them. We really want to take some of this information in and use it to help shape 2024. Not seeing a lot on there, so I'll continue to sort of narrate over. Robert, do you have a question? No? Okay, I thought I saw your hand up. Any issues with the Jamboard, please feel free to come off of mute. You can share your information in the chat. What do we want to start doing? More quality metrics, absolutely. What do we want to stop doing? And what do we want to continue to advance? Presumptive eligibility is a big one. How about that best practice playbook? We're hoping to continue to do that in 2024. Anything else we want to start doing in 2024? And anything that you didn't like about 2023? I'm not super sensitive, so if it's me, you can just say so. I won't cry about it, I promise. We really want to hear from you guys. Oh, Emily. Thank you for that. I was trying to fill in the dead air.
I'm sorry, I went to the restroom. Is the meeting over?
Nope, not yet. We're actually doing an exercise. If you want to, I'll reshare it for you in the link.
Okay,
We have a
thank you.
Jamboard going about what do we want to stop doing? What do we want to keep doing for this PATH CPI in 2024? What aren't we doing today that we would like to start? So we call it start, stop, continue.
Thank you.
Absolutely. And I'll reshare that Jamboard so that you don't have to dig through the Slack, or excuse me, the chat.
You can just girl
Please.
talk.
Can you?
Yeah.
Oh.
You guys okay out here?
Oh, Only Murders in the
Hey,
Building.
Yoma.
I love that show. We'll give it about 5 more minutes. Still seeing some action, but things are starting to slow down. Agnes, I'm just gonna copy yours over to the Jamboard. Thank you so much for sharing. And then Emily, tell me when we're at time.
I'm hoping this is what our environment looks like tomorrow, Denise.
I need it. I need the ambiance. I'm not done with my holiday shopping and I need some. Thank you, Emily. What are we going to do with this information? So just a couple of things I want to highlight. We're gonna keep this live and we'll share it via Slack. So for folks who were unable to join us today, that we have this open for a little while, we will start to take this and put it together into a different visual. But if something comes to you after the fact, please share it with us either directly on Slack or through the use of this Jamboard. Before we move forward, I just want to, and anybody can unmute, couple of observations I'm seeing. I'm seeing not a lot of stop, but the things that we want to stop are the things I completely understand stopping. Survey fatigue is a real thing. I wonder how we think about data collection in different or more efficient ways. How can we sort of automate data collection? How can we get data through different means so that we might be able to survey less? I think surveys themselves will never go away. It's the only way we can share opinions. But we also share a whole heck of a lot via surveys that aren't just opinions. They are things that we might be able to automate through data exchange. Janet, I don't know if you're still on, but I noticed you put something in the chat earlier that you were coming from another meeting. If you want to share that with us, that would be really helpful. We try as much as we can to accommodate schedules, but if there are other, especially state larger meetings that you folks are attending, we certainly don't want you to have to decide between that and this meeting, although we know that this meeting is a heck of a lot more fun.
Denise, was that directed at me? This is Janet.
Yeah, you mentioned in the chat earlier.
Yes. There was an enhanced care management and community supports HCPC coding guidance webinar updates about stuff that is changing, clarifications for the current year, and then some coding guidance of things that are changing in 2024. Although right at the end of the meeting, they said that those don't take effect until March 31st, 2024. So I was a little frustrated with that. But that's key to this group. So anybody that like on the ground staff, definitely, you know, we let our revenue cycle folks and our CalAIM staff be aware of it. It wasn't the best webinar, but they were providing information. And so this is more like ad hoc, you know, you have to kind of just be on top of this DHCS calendar. And that this example, you know, 2 months ago, maybe we wouldn't have even known there was a meeting today. Yeah. The other one that was from Thursday, there's a quarterly DHCS Managed Care Advisory Group meeting that is usually standardized, I think, probably on the second Thursday of every month. And this was the, you know, that was where our subgroup for the data standardization work group.
Okay.
Yeah, so I feel like I haven't been able to attend, and I think there were some earlier in November or something. I keep missing them. So I feel bad that I'm not there. I will attend when I'm available, but just things have cropped up like that.
Thank you for sharing that. We'll do some digging, and you know, we can also work with you know, our third-party administrator PCG, especially for state events, so that we can you know, work around trying to accommodate folks' schedule, especially critical events like this. And if for whatever reason we can't, we might be able to at least elevate from an awareness standpoint, because I would wager, you know, everybody's calendar these days looks double booked and triple booked more often than not. And so if there's ways that we can share the recordings and some of those other resources, we'll use Slack as a vehicle to do that as well. Any other comments around things that you want to start doing, stop doing, continuing to do in 2024? Anybody want to elevate anything that has been written out, if it's yours or not, is irrelevant. Okay. Oh, here we go, Robert. You've got one. I see your hand is up.
Yeah, I actually did not. I won't blame it on my dyslexia, but I didn't put anything in the boxes. But I do have some real concerns in regards to this overall, and my population is the justice involved population, and I'd like to be able to get some clarity. And I don't mean now, but moving forward with regards to some of the complex issues that the justice involved population presents to the managed care plans. Because one of the things I do want to stop is not getting answers to some of these problems that are going to affect this population. And as an example, I have some very valid and sound suggestions with regards to some movements that should take place in regards to justice involved coordination, since the 90-day in reach has been pushed back a whole year.
Yeah.
And in addition to that, for the managed care plans, um, some of my data that has been released by CDCR and other justice involved agencies revealed that a larger percentage of individuals will come out of custody at a palliative level of need. And I know that Senate Bill 1004, Medi-Cal palliative care, was implemented, and there's been some work on that, but the managed care plans haven't identified that in regards to this population. And in addition to that, what I brought up before is that this population is going to come out, and 90% of this population is going to live in a temporary housing setting for at least a year. And have the managed care plans decided to do some partnering with some housing agencies so that ADA accommodations can be retrofitted, because the community support funding can't be used in a temporary setting, because then it does not really benefit the individual. So those are just some of the things that I really like to keep on the table for the justice involved population. And as you know, I'm trying to increase the overall value of my services in this for this population. And at some point in time, hopefully next month, I'll be prepared to meet with all the managed care plans for this population.
That's great, Robert. Thank you for sharing that last part. And I think to your earlier comment, everybody in this meeting is coming at it from a different lens. And I think I speak for you, Robert, in that some of these things are critical and unique to certain transitions, but they're not necessarily unique to the work that we all do. We do it in different places and different phases, and sometimes with different populations. But the narrative and the impact and the critical impact that it has on people's lives is huge. And so I think that those are all really big things to work on, to continue to work on. And I'm going to follow up with Dr. Tudor as well on the comment that she made earlier. San Diego's the place to do it. I mean, at least there's some infrastructure to support more so than in other communities, counties across the state. So definitely continue to do that work, and hopefully we get some clarity in that regard.
Thank you. I just want to reiterate, because if not, that justice population becomes our homeless population.
Yeah.
So it's just like we're working for nothing if we don't do it right.
Yeah. Yep. And I think the moral of the story too, and I know where I'm at time. Emily, I'll have you move over to thank you for that. So just a really quick two things, Robert. We'll take, and we added your comments to that board. So Emily and I will work on making that a visual and sharing that back with the collaborative. We'll also push that out via Slack. So if we have folks who weren't in attendance today, they'll have access to provide some feedback. We will continue to kind of use that as we shape together at least our initial plan for 2024. A couple of other sort of general housekeeping. Don't forget to register for your 2024 meetings. The office hours, we'll talk to you all a little bit more about some changes that we'd like to make for those office hours. We also have some fun ideas for 2024 as it relates to networking. Last but not least, tell us what you think through that participant survey. I think this is sort of the thing, right? We like I said before, have survey fatigue, but surveys are always really helpful to gather opinions on your overall experience. So please share that information with DHCS and PCG. They will certainly share that with us as well. I'm going to pause here because we're going to transition to our managed care plan office hours. We're going to do things a little bit differently this month, but if anybody on the line is not staying on for the managed care plan office hours, you are free to drop. We'll share this recording and presentation with everybody. We want to thank you for spending the time with us today, and we want to wish you all a very happy holiday with friends and family. I hope that you all enjoy some time spent not working. For those that are staying on the line for the managed care plan office hours, we have managed care plans with us on the line. Historically, what we did was break out into different rooms by managed care plans, but we found that for some of you, the questions that you have are for more than one managed care plan. And so we're gonna do our best for this office hours. Emily and I will stay on, we'll help facilitate and navigate the conversation. The managed care plans are on to hopefully answer some questions that you all have. Emily and I will take notes. So if for whatever reason we don't have an answer for you, we can collect that information and work with the managed care plans to do that follow-up. So no breakout rooms today, but we have managed care plans on the line. And for those of you who do have questions, please feel free to come off of mute or raise your hand. And when you come off of mute and or raise your hand, please introduce yourself and your organization before going over your question. If it's specific to a single managed care plan, please also include that in your question. It looks like Deepak, we have a question from you.
Yeah, hi. My name is Deepak. I'm from Sprite Health. We provide technology infrastructure to ECM and CS providers across the state. My question for managed care plans is next year, this is year 3 of CalAIM. And we've already seen, what happens with data sharing and billing. Standardization is critical, and how much administrative burden it can cause to providers when there's no standardization. So my question is, typically in these programs, the next step is quality metrics. So has there been, any discussions between the plans on how they want to standardize quality metrics? And are the metrics going to be based on specific populations? Are there going to be different ones for community supports? And have they heard anything from DHCS in terms of guidance? Thank you.
Absolutely. Those are really great questions. I don't know if managed care plans on the line want to take first pass. I can talk a little bit about the data standardization work group as well, and some of the other things with DHCS, but please, managed care plans, feel free to take first pass.
Hi, everyone. Claudia Velasquez with CHG. I can answer portions of your question, Deepak. Conversations are constantly taking place about that. What makes it challenging is that we haven't received guidance from DHCS, at least to my knowledge, or someone else, a plan partner, correct me if I'm wrong, maybe very recently, with regards to what they will be auditing for ECM and CS. So that makes it really hard. And sure, we're going into year 3, but with so much change and so many new rollouts of populations of focus, policy changes, standardization changes, it feels like we've been playing a lot of catch up. So, venturing into something new like that in kind of the gray is really difficult to execute. So we're really anxiously awaiting to hear what kind of quality metrics DHCS will want to know. Internally here at Community Health Group, we have kicked off a bit of HEDIS tracking. So that at least will tell us if the enrolled ECM members are resulting in less utilization across the board from our highest cost Medi-Cal services.
Thank you.
Yeah, this is Rain from Blue Shield. Thank you, Claudia. Echo everything that you mentioned. I think the other tricky piece is that initially DHCS did make it very clear. This is with relation to community supports, that these services were medically appropriate and cost effective. That cost effective piece, I think, is where this quality part really comes into play in terms of how we can ensure that the services are adequately replacing higher cost types of services. But the tricky part is that DHCS actually took that element, the cost effectiveness piece, out from what we have to demonstrate or feed to them. So I think that caused a lot of confusion on the MCP's side of the house, at least from our perspective here at Blue Shield Promise, about what that then looks like, because we're all working on modeling internally. But to your question and Claudia's point, and we really haven't been given, really any clues. And in fact, those clues kind of got taken away from DHCS. So we're still awaiting what that really looks like. But I think it's a really relevant question and something that obviously we're all looking to find ways that we can demonstrate, the effectiveness and the benefits of these programs in a way that tells the story of what all of our providers are doing on a daily basis. So I'm not sure how much that adds, but just wanted to chime in.
Thank you.
Yeah, hi everyone. It's Arif Sheikh from Kaiser Permanente. I think my colleague said it really well. I think one more thing to point out, aside from I think the biggest question, which is the lack of DHCS guidance on this, is that while the plans are all working, of course, on quality, Kaiser is definitely we definitely have quality oversight as well. And I think the other piece about the changes is that aside from just everything that's happening with Go Live, for 1/1/24 with all of our new contracts, is that there's managed care plan transitions happening as well, which is a really big area. That we're all trying to make sure that happens in the most seamless and responsible way to make sure that members have access to coverage, that there's no gaps and issues whenever there's large transitions, right? That's one thing we always look for. So I think definitely not to diminish, I think what you were saying, Deepak, I think that's a very important call out for sure. And I think I would say that I don't want to speak for the state, but speaking for the plans, and I think hearing from the state very clearly that the transitions is just a critical component, especially in the first quarter of the year, to make sure that goes right. And that's something we're all doing together, right? So I know we're all part of that work.
Is it safe to assume, given that CS were initially and still, in lieu of services, is it safe to assume that at the minimum, the plans would be looking at the utilization trend on, ER and hospitalization? So that way, if providers can start tracking their own performances against these two metrics, though there could be more specific to each CS, each population of focus, but at the minimum, is that how you would normally look at the impact from a cost perspective?
I think that's right.
Yes.
Yeah.
That's fair.
Yes.
Yeah.
Thank you.
And then obviously, like you said, for very specific, like I'm just thinking medically tailored meals, for example, right? Then there could be more distinct or the ability to track on actual, condition outcomes. But yes, I think that's a fair assumption.
Thank you.
Deepak, that also sort of aligns to some extent with the data exchange framework and some of the data sharing requirements around those ADTs. So, it's something to kind of think about if you're, in the technology space around bringing that information in and or sending it out in an automated way and or, putting together some of those utilization reports for individual providers using a piece of software. So
Yeah, what what we're thinking about is, there are standardized. There was a question on the Jamboard, which is great. There are standardization on intake now, assessments. But then, in any care management program, you have progression, and transition. So
yeah,
part of the transition, if there could be some standardization on outcomes, when you're transitioning somebody out of, say, to a housing tenancy program, and that itself could lead to some outcome tracking, which could be, which could be very, again, like I understand DHCS has a role to play in this. Yeah.
thank you for that. Any other questions for the managed care plans? Janet?
Hi, yes, good afternoon, everyone. This is Janet Vadicum-Cherry from Health Center Partners. It was my understanding that the ECM and community supports kind of provider directory of each managed care plan would be publicly available on the managed care plan website. But I'm not finding that to be the case in all instances. Am I mistaken? I was looking for a community supports provider for one of the managed care plans and found out I have to be a provider so that I can log into the provider portal in order to be able to see who they're contracted with for certain community supports. And I thought, anyway, I'm just wondering if I was mistaken about the public domain piece.
Hi, Janet, I can kick us off there. No, you're not mistaken. And because this information should also be accessible by members, right? And individuals in the community. So if it's with any of our specific plans, I think we'd all be happy to connect and make sure you have, the correct links and direction and so forth. The other piece, and then other MCPs keep me honest here, I believe 211 is also helping to keep a depository of that. So that may be an easier way in the interim if you are having difficulty. But again, all plans we're very much, aware that there can still be some challenges navigating those systems, and we would like to support that and have offline conversations if need be.
Great, thank you. Since you mentioned that worksheet that 211 is maintaining, and I thank them for doing it, Alana, whoever's doing that there, I think it was last updated in August, and there might be not a lot of changes. As you look across the managed care plans in each of the 14 columns for community supports, there's not an X in every box, but we know that everybody's providing community supports for all 14. So I guess I would ask that, and I don't know what the process is for CIE or 211 staff and working with the managed care plans or how that happens. And I know there's some validation that 211 does, but it seems odd to me that we're missing X's in some of those boxes as to, who's contracted for that service. So that's on my list to kind of follow up with, but I'll just put that out as a FYI to the group since we're talking about that now. Thank you.
So as the provider network continues to grow, it is a challenge to keep certain directories current, especially when multiple sources are housing them. So I would just strongly encourage everyone to revisit our websites, maybe mid-January, for a more accurate, updated source of truth of who are the current ECM and CS providers in each of our networks, but I did add this in the chat box that DHCS did conduct an audit of all managed care plans websites to ensure that that outward facing, information was accurate and met their standards, including the provider network. So it might be just additional information that we can provide to all of you offline, MCP specific, and you can reach out to us and we can guide you.
Thank you. Could, is it Rainey? Is that how she pronounces her name? From Blue Shield?
Rain. Hi.
Sorry. Oh, that's even nicer.
No, you're fine. You're fine.
Could you put your email in the chat for me, please?
Absolutely.
Thank you.
And I think the other thing when we talk about data and opportunities to build efficiencies or automate, this is something to sort of think through and consider. I know it's a topic of conversation and something the CIE has that list, but what does data reconciliation look like? And is there a way to have sort of that no wrong door with different things that we do and how we look at data? So, is there a world where you would be able to see the most up-to-date information on a managed care plan website and also see it in a community directory that is agnostic, both from a provider or payer standpoint, which is sort of not to sort of say what the goal is, but really what I think that the goal is of that repository on 211's website. Any other questions for the managed care plans?
I have one comment, if it's possible. I did ask the same question in the DHCS meeting as well that just concluded. So the health plans, they have started sending ASF files, which includes, ECM provider name, so which is fantastic for providers who are themselves not ECM providers. So it's good to know who is the ECM provider. Sometimes it also has phone numbers. That's great. But purely from a data integration perspective, it would be helpful if they can add the ECM provider's NPI number. Name alone isn't enough to connect the dots. So as you start to have your directories, you have CS, the files, it'll be easier for the data to connect if CS providers, instead of looking at that specific column in, whatever 20th column, if it automatically surfaces and say, here's the provider. And also, when they start their services, those notifications will go more seamlessly. They have the data because they're adding phone numbers and names. So if it's, that's a request.
Yeah, thanks, Claudia, for that comment. I think that it has that when, but it doesn't necessarily have that in the other direction. So like if I'm looking at a directory or if I'm looking at a network, it wouldn't necessarily come over for that second hop, right? So it might be going over to you from DHCS. Is that the file that you're referencing?
I'm referencing, is it for me?
For both you and Claudia's response.
Yeah, so I'm referencing the file that is sent by the health plans to community supports provider, the ASF file, authorization status file. Towards the end of that file, there's ECM provider, their phone number, but not their NPI number. So that's what I was referring to, just for CS file. Yeah.
Sorry, I can't speak to that. I don't believe that's with CHG.
Deepak, though, I've been bugging the managed care plans, and I'm sure I'm driving them crazy to get a contact in IT because, each of the managed care plans has a data exchange framework compliance plan. And I think the comment that you made is true, because what you're trying to do is from a computer standpoint, when you're bringing that information in, match it to where it needs to go in different places when you're looking at a record. And so the more that you can receive information in some sort of a unique or numerical way, the more helpful it becomes from a technology standpoint when we're trying to automate and bring that in for the end user. So I hear you. I'm curious, what that would look like. It's probably something that's fairly easy to do. It's just not necessarily been included in the file.
Because, there was a question just to ask a few minutes ago, finding the right CS providers. That's great. But then there's a lot of work that's done after that. And instead of, just with that simple information, that whole closed loop referral process could be much easier.
Yeah, that's a really good point. And something to consider too. And I know that the folks from the CIE aren't on the line anymore, but it'd be interesting, Deepak, to talk to them about that as well, because it's data that's collected and also too, in some cases, readily available, right? You can do a search and get it on MPES's website. Could we include that in, even in the CSV file that represents the community directory? That would probably be an easy lift. Any other questions for the managed care plans? We've got about 10 minutes remaining.
This is Janet at Health Center Partners. I do have some pending, but they are already in receipt of them, and I think they're being addressed separately. So I'm not gonna waste people's time unless somebody wants me to bring one or two up, or they want to talk about anything that I had previously presented. But so that's why I'm being kind of quiet, because they already have my list. Thank you.
Thank you, Janet. No, I think there's a couple, and I just got some contact information from you, and I talked a little bit with Christy and with the county as well, because there's some, there's some pieces of the puzzle that are specific to managed care plans. And thank you, managed care plans, for working in collaboration to address those comments and questions. We really appreciate it. But, I think in addition to that, Janet, there might be opportunities to think about some of the other things that you brought up, both in, how might this look as a test of change? What might we be able to do, not just, under the managed care plans, but also as a community to look at some of those. What information do we need in order to elevate? So, conversations to be had in that regard as well. But the managed care plans have been keeping me updated, and as soon as they have that information together, we'll get that over to you.
Thanks.
Any other questions for the managed care plans today? Wow, quiet bunch. Managed care plans, run. I'm kidding. I've had a lot of coffee today. Everybody else seems kind of sleepy.
I'm laughing on mute at that one.
Oh, okay. Fair enough. Fair enough.
Ditto.
We have, James, for in person, we have tentative for April, not February. But throwing this out there to anybody who's got a space big enough to host, we'll be looking for opportunities to try and collaborate on that in April. And the other thing is that we know that there's a ton, thanks, James. We know that there's a ton of stuff happening in San Diego all the time. So if you guys are familiar with any conference where the majority of the participants of the CPI are part of the Oh, wonderful. Thank you, Arif. We'll be, yeah, we do. Oh, cool. I love it. Thanks, Managed Care Plans. We'll reach out to you. Emily and I are gonna start planning shortly. We know that it's a little bit of a logistics, so we'll give you all some dates and see if it works for any of you all for hosting. And then maybe what we'll do is talk with you as well about some plans for October. I don't know that we'll be able to make this happen, but I would love to do a regional summit. I think that it might add some value to folks in the community who work outside of the county. How are we sort of addressing individuals who work in and around or move in and around the counties that are closest to San Diego? So we're reaching out to the facilitators, and we'll try and work together with them to put together a regional summit. It might also allow us the opportunity to bring in some guest speakers and bring in some other types of content that we wouldn't normally be able to do under the existing structure.